Hello all, I'm Dr. SK Gupta, consultant clinical hematologist, hemato oncologist, bone marrow transplant and the CAR T-cell specialist at Continental Hospital, Gachibowli, Hyderabad. And I thank you all for viewing these videos. World Sickle Cell Disease, which we do celebrate on 19th June of every year. I would like to share my view on the sickle cell disease and its treatment, diagnosis, and what are the recent advancement. So sickle cell disease, let's start with the basics, which is a one of the hemoglobin disorder, single gene disorders, inherited disorders, where we do get the defective hemoglobin leading to the change in the shape of the red blood cells from a flexible discoid shape to a rigid and the sickle shape, because of which the red blood cells is unable to move freely on the whole blood circulations, leading to the early rupture of the red blood cells, ending in the low hemoglobin, anemia, as well as the more importantly the blockage of the blood vessels, causing the tissue damage due to the decreased oxygen supply, ending in the end organ damage. So the complications what we do get if the disease is not well addressed is such an end organ damage leading to the stroke, and in the long term we can have the hepatopathy, nephropathy, ending in the dialysis, also bone damage, especially the joint areas. We do get the avascular necrosis due to decreased blood supplies. There's a severe pain ending up the hip replacement, specifically. Patients do have the poor quality of life, such as because of the ongoing pain and the blood transfusion requirements. So these are the issues patients do have with the sickle cell disease, especially in the severe aspects of the sickle cell disease. But the good news is that if we do have certain treatment to improve their quality of life, the treatment to cure this disease. Treatment to improve the quality of life starts with the consultations with the clinical hematologist at the time of the diagnosis. During that consultations, we can discuss both the type of options, such as improve the quality of life, starting with the pills, hydroxyurea, folic acid, multivitamins. We do have the recent few advancement on these improving the symptoms aspect medications, also based on the patient which problem is common, like anemia is there, then we have some medications for that. If the pain is the biggest issue, then we have the medications for that one. But please do mind that these treatment measures which just I have discussed does not cure the disease. So the second category of the treatment is to cure this problem, and that is in form of the bone marrow transplant, where we do change the defective manufacturing unit, that is a bone marrow, which are making the sickle cells with the healthy donor cells, and they can, so that the patient get the healthy red blood cells and the disease can be cured. So this bone marrow transplant can be done as young as 2 years of age in the sickle cell disease aspects, and it can be done at the even adult lives also. So the timing is very important for the sickle cell disease. The end organ damage before that it starts is also another important aspect if we really want to get the good success with the bone marrow transplant. So these are the, I think, treatment aspects which are available at currently we are being used across the globe. There's some development in the advancement in the sickle cell disease in form of the gene therapy, where we just don't do the whole bone marrow transplant. We do have the genetic scissors. We cut the defective gene and we take a healthy gene and paste on that normal locus of the gene. So gene therapy has also come up, but they are quite expensive as of now for our Indian settings. The tune of around 18 to 20 crores rupees. I think it's the best suitable therapy in our context is the bone marrow transplant, allogenic bone marrow transplant, which is a good success rate in the tune of 70 to 90%, and we are doing that at Continental Hospital. So we have discussed about what is the sickle cell disease, what are the complications, and what the treatment options are available. Let's have a look on the how can we detect. There's a happy news that this disease can be detected with a simple blood test known as the hemoglobin electrophoresis, and can be done through the blood. The results takes hardly a day, and we can confirm it. The important aspect is some patient may not have all the problems with the sickle cell disease. They are just carrier. The carrier meaning sickle cell disease is a genetic disorders, and is autosomal recessive genetic disorders. We do have the 2 copies of the genes for this sickle's hemoglobin or healthy hemoglobin. So patient develop the disease when both the copies are defective. Some patients, they have only the one copy is defective, other copy is fully functional, so they may not have the disease issues, but they have they are carrier of the sickle cells. So this sickle cell carrier detection is also an important. We can do with this simple hemoglobin blood test, because if the two carriers they mingle and they try to have a baby, then there's high chances then we can have the sickle cell disease to our offspring, our kids. So for them, I think the another good news is that we can check when the baby is inside the uterus, and with the simple genetic testings, and then we can move forward further for the steps to prevent the disease and early detection of that issue. Uh, so so my overall message on this World Sickle Cell Disease to my whole community, my Indian community, my across the globe medical and the non-medical community, the sickle cell disease is a quite common. Don't take it; it's a rare disease, quite common, and I've seen the patients suffers a lot with the poor quality of life. But if they do get an consultation with a clinical hematologist on timely consultations, so the quality of life can be improved. There's options, we can cure this issue. So please do come forward for consultations and discuss all your doubts and clarify on that. Thank you for watching the video. Please do comment if you have any concerns or questions.